It's this phenomenon of increased scrutiny over selfies, and this new trend we're seeing that has patients seeking out cosmetic procedures to not only improve their look in selfies, but also to look like filtered and altered versions of themselves with perfect hair and unblemished skin, smaller noses, fuller lips, bigger eyes.
And this is from teenagers?
So my patient population, I treat adults, and so what I am seeing in clinic these days is a younger patient population, and so the patients who are in their 20s to early 30s are often bringing in selfies. They want to, firstly improve their look in a traditionally taken selfie or look like an altered version of themselves.
Wow.
Dr. Vashi, this is Mike Huckabee. First of all, not everybody can look as beautiful as I do, so I realize plastic surgery is necessary for some people. But in all honesty, this done on a teenager, would this not even constitute some level of malpractice? If teenagers are having their faces completely reshaped for reasons that have nothing to do with any medical reason other than they want a line taken out. I mean, for a teenager to make this decision, I just find that frightening.
So I don't treat teenagers for this reason, and I think that most cosmetic dermatologists like myself and plastic surgeons also do not treat teenagers in this type of fashion. Yes, for medical reasons such as a nasal defect or a cleft lip or palate, younger kids and teenagers will get plastic surgery, but not for cosmetic reasons. We're calling Snapchat dysmorphia maybe a trigger to something more serious called body dysmorphic disorder. And body dysmorphic disorder does actually present in the young teen years.
Right.
But patients don't present to clinic until their early 30s, and that's because they don't have the means to obtain plastic surgery or some kind of cosmetic procedure.
Yeah.
And also, younger than 18, they need a patient consent. So not only do they have to have the means to have this type of treatment, they also have to have a patient consent.
Body
to obtain
dysmorphic disorder. Christina, they're blaming it on this study. The study published in JAMA Facial Plastic Surgery Viewpoint found that apps like Snapchat and photo editing Facetune are to blame for this.
Facetune. So we were talking about this before. This is a trend I've seen for quite some time, which is why I almost don't trust any photo online, because with some of these apps that you can buy in the App Store, you can shrink your waist, you can shrink your arms, you can you can make your skin flawless, make your eyelashes longer, make your teeth whiter. You can completely alter your online self, which I think is what is contributing to a lot of these younger women and older women wanting to change their facial features. I think it's just horrible, and it needs to stop. But I guess they got to delete the apps or make them really, really expensive.
Well, I don't know about the apps. I mean, the apps, certainly you can change the picture, but to actually take the picture and go to a dermatologist and say, make me look like this, I want to have plastic surgery, that's really where the horrible part of the story comes in.
Yeah, doctor, I'm wondering in terms of the scale here, how much of your practice is now people coming in with specifically this issue? They want to look like they do in an app.
So I get both. I get patients who will bring in a selfie and say they want to improve the look of the selfie. They say they will have a facial asymmetry or a groove in the face. And then I also have patients who do come in with a filtered photograph. I had one patient come in with the crown of flowers from Snapchat saying that she wanted to look like that filtered photograph.
That's incredible. Dr. Vashi, thanks so much. We appreciate your time this morning. We'll be watching that.